my name is Dan Jameson. I'm the Pulmonary Critical Care Fellowship Director here at MedStar Georgetown University Hospital. We are focused on training the next generation of academic faculty and attendings in pulmonary critical care medicine. We have a long track record of success. Our faculty goal is to create future leaders in the field as well as future colleagues. Please join me over the next few minutes while we give you a tour of our facility and introduce you to some of our outstanding faculty and fellows who truly make this program and this fellowship one of the best in the country.
I'm the division chief, and we'd like to really introduce you to our program. Our fellowship has been training excellent fellows for the last over 40 years. We have a breadth of clinical experience, research opportunities, and educational programs for the fellows that have a long tradition here at Georgetown.
Hi, I'm Jigna. I'm one of the second-year fellows. Here I have Christian, one of our first-year fellows, and Miriam, one of our other second-year fellows. We just briefly want to tell you all some of our favorite things about the program. In particular, I love procedures. We get so much procedure training, whether it's on the consult service, in the bronch suite, in the ICU, and even in the emergency room. We own all of our intubations and chest tubes and perc trachs. In fact, Christian actually has a pretty good story about his 2 months here.
Yeah, actually I couldn't agree more. So in the 2 months that I've been here, I've already done multiple procedures, including in the bronchoscopy suite, doing bronchoscopies obviously, bedside bronchoscopies in the ICU. I've done 2 percutaneous tracheostomies at the bedside, as well as a few thoracentesis on the consult service. Besides procedures, we also get a great amount of teaching here from the various faculty, including Dr. Reed with hemodynamics and Dr. Vinayak with right heart cath and right heart physiology. So lots of opportunity for learning, and not only from our faculty, but also from the various faculties on different services, which I think Miriam tends to enjoy.
Yeah, so one of my favorite parts is the collaboration between the different departments. We have combined pulmonary rheumatology, ID conferences, and once a week we have our thoracic oncology conference where we get to discuss different patients that we later meet and have the different services between the radiation oncologist, the oncologist, thoracic surgeons, and pulmonologist meet the patients and discuss their care.
Yeah, and so one of those places where we meet them actually is the bronch suite, where we'll take you to next, and you can see what we do to assist the attendings with interventional procedures.
Hi, my name is Irina. I'm one of the third-year fellows, and I want to talk to you guys a little bit about our procedures. We do a lot on the floors in the ICU, but one of the things we love the most is being here in the bronchoscopy suite. We get to do most of the bronchoscopy, the transbronchial needle aspirations, we get to use the EBUS over here and do a lot of the biopsies. And most recently we got a robot here to help us get to nodules and do more things for diagnosis of lung cancer. And Dr. Anderson is our director of interventional pulmonology. He works with us closely and he can tell you guys a little more about the robot.
We are doing 500 plus procedures a year here in the bronchoscopy suite, plus 200 to 250 in the ICU. One of the most fun things we've gotten is the Ion Intuitive's robot to do bronchoscopy. You're going to get a chance to see this in real time when you come to join us in our pulmonary program.
Well, welcome to Georgetown Hospital, the MedStar Georgetown University Hospital. I'm Dr. Charles Reed. I'm the director of all the adult ICUs here. And I want to share my wishes with you all that are looking at this program to let you know how great it really is. And one thing our division has always been important to us and always been a precedence is the teaching. Saul Katz, my mentor, the godfather of pulmonary, was all about teaching. And that's why our fellows will win almost half or more of the teaching awards every year for the best fellows since the last 15 years. Faculty have won multiple golden apples. It's all about education and it's all about family, and we're very excited to see if you all can join our loving, caring families.
Welcome to our ICU. As fellows here, you'll be asked to do a number of tasks, including rounding independently on our critically ill patients, as well as performing a number of procedures, including endotracheal intubation, percutaneous tracheostomy, and chest tubes. Now that you've seen our ICU, how about you take a look at our outpatient clinics.
I'm I'm Lindsay Orr. I'm a second-year pulmonary fellow here at MedStar Georgetown University Hospital. We're in the outpatient clinic, and I'm here to tell you about the patients you can expect to see over the course of your fellowship. At the start of fellowship, you're assigned a clinic preceptor who you remain partnered with for all 3 years. This continuity allows you to develop your own patient panel and provides the opportunity for ownership of their care. We see a wide variety of pulmonary diseases, including bronchiectasis, COPD, asthma, interstitial lung diseases, lung cancer, ALS, and also sleep disorders. We have a PFT lab here in clinic and a sleep center at the hospital as well. Sometimes we do procedures in the clinic with our interventional pulmonary attendings, such as thoracenteses or pleurax removals.
My name is Rajiv Santi. I was a fellow here and stayed on as faculty, and I think that the best part about fellowship here is how crucial the fellows are to everything that we do. You're not a little ancillary side group that intermittently pops in for teaching, but you do everything we do, and we do a lot. It's a tertiary ICU in the middle of the city, and a transplant center, interventional pulmonary, interstitial lung disease, pulmonary hypertension, and you do all of it. It's a small fellowship, no doubt, but that's actually a good thing because there's a supportive culture among faculty who are invested in teaching your development, and with the amount of experience you get during fellowship, you are prepared for your job on day one when you graduate, whether it's pulmonary, critical care, or some combination thereof. I stayed on because I love the variety of what I can do on a day-to-day basis. Last week, I saw a clinic and I started poorly controlled asthmatic on an immunomodulator drug. I did a call where I did a bronchoscopy and floated a swan, and I worked on a manuscript with a med student and a colleague about our COVID data. So there's a lot going on if you want to participate.
Thank you so much for joining us on this quick tour of our facility and program. I look forward to reviewing your application. Please feel free to reach out to any further questions.